get ready to strip down half naked. Your limbs will be flying all over the place. You will be thrown around like a dummy. Your pick. Welcome. It's Angel. I'm a student physiotherapist. Is a physiotherapy degree really meant for you? Are you what decision are you going to make? Now, I understand you're looking for a course that suits you. I will give you the tea. I will give you tips. I will give you a brief idea of what it takes to be a physio. And if you're like me, stop between crossroads, medicine or physio, which one has more money? Just get straight into the video. Cue the intro. Action. The main objective of every physiotherapist is to improve function, recover function, movement in the body, to improve the quality of life for the patient. Whichever one the patient is struggling with, our job as a physio is to rehabilitate them. It is very people-based, this is very therapy-based. Physiotherapy is not like medicine, and I'll get into that. So you're expected to come up with diagnoses for the patient, give them treatments according to what they have presented in front of you, assess the movement, assess whatever you need to come up with a conclusion with your clinical reasoning skills. You as a physio make the conscious decision on your own on whether this is the best way, the best method for the patient. Now, the thing I love about physiotherapy is the fact that it looks at the patient as a whole. It looks at them as one unit. So their lifestyle, their welfare, how they sleep, how they eat, where they work. Are you active? Are you not active? Are you a smoker? These type of things. And without this information, without asking certain crucial questions to the patient, you may be missing out on valuable information that can help you to come up with a treatment. Exactly what it says on the tin. It's physical therapy. What does this mean? There will be lots of touching. There will be lots of hands going everywhere. There will be lots of moving patients around. And I mean this in the most professional way. You will be touched, and there is no avoiding it. When you come to class, get ready to strip down half naked. You might be a model for the class in front of everyone. If you are insecure about your body, if you do not want to show any of your skin, if you are conservative, physiotherapy is not the one for you. I'm going to make sure that you understand now that you will be acting as a patient half of the time. You will be prodded and pricked and all sorts of things. Your limbs will be flying all over the place. You will be thrown around like a dummy. Okay, and there's no way around it. There's no escaping it. So don't get shocked at the fact that you will be in a crop top and shorts half of the time during class, half of the time during your entire course. Okay? It's evidence-based practice. You'll be expected to do lots of research, reading journals, reading articles, extra reading outside of the course, outside of your module, getting in information and staying up to date with the new research and assessments and treatments. You got to keep researching. Base your exercise, base your practice on those researches. So there's no avoiding reading and writing essays. There will definitely be more practice, more practical than theory in physiotherapy, which is good. Physiotherapy is not personal training. Give patients exercise and you teach them how to exercise. No. A lot of physios, you'd be surprised, are terrible at exercising, but they don't have to be amazing because the patient isn't usually normally or an experienced level of exercise. They just need certain bicep curls and squats. Especially coming from a gym girl myself, you have to tone it down a lot. You can't say certain words like form, like glutes, hamstrings. You can't say that. You gotta say leg muscle, buttock muscles. You need to say technique instead of form, because you will be dealing with old patients. They want you to apply to the NHS. The NHS needs help. So you will get a nice fat bursary of 5k, £5,000 straight up, no strings attached. That's a good thing. Patient-centered, where you want to get through to them for you to get out of them. It's a help me help you process, and it's your job to get it out of them, to help them, because they're here for a reason. They're here to be fixed, and you need to be able to supply that. Medicine doesn't have that. Medicine doesn't give you the opportunity to relate with people, to relate with patients, to talk to them, to get to know them on a personal level. It doesn't give you the chance. You have to make 10-minute appointments when you're doing medicine, and it's quick, it's fast-paced. If you want fast-paced, go to medicine. If you have a headache, paracetamol. If you have this, you have that. If you have X, you have Y. Whereas physiotherapy is more based on what does the patient want to do? How do they feel about this? How do they work well with this exercise? And more inclined to do this exercise? Start caring about the person. Long story short, if you don't care about the patient, if you don't really care about getting to know someone, medicine. 6 to 7 years of university is not for me. 3 years in physiotherapy and going straight into the industry is exactly where I want to be. And if you are on board with what I'm saying, physio might just be for you. Yeah. Another reason why I chose physiotherapy over medicine was the fact that I'm an extrovert. I love talking to people. I love getting to know new people. I love digging into people's stories, understanding who they are. Everyone has their preferences. Physiotherapy is hands down more fun than medicine. You will have great fun in your lecture. It's more laid back. Even in the workplace, physiotherapists I work with, they're great people. Most of them are really young, they're vibrant. Lunchtime is always interesting. You got some jokes flying around the room. When you're dealing with doctors, on the other hand, it's much more serious, much more rigid, much more intense. It's up to you, which is probably why people don't take physios as seriously. But it's okay. Medicine will open more doors, higher pay rates, higher demand for doctors. Everyone's looking for a doctor. Doctors are more respected. Physio, on the other hand, is rewarding. You build connections, you build your social skills. The pay may not be as high, but you don't have as much stress as doctors do. You don't have to worry about drugs and prescribing, and drugs don't even help. Exercise actually changes people's lives. The exercise prescription route or the drug prescription route, your pick. I'm not going to make the decision for you. I'm only helping you. Physio is not all about muscles and massages and stretching and exercise. That's one thing they will check when they're interviewing you. The fact that people think, oh, physio, sports, rehab, sports, exercises, personal training, gym stuff. I love sports, so I'm gonna be a good physio. Darling, it's far more complex than that. It's far more intense, far more sporadic. You've got the cardio physio, you've got the respiratory physio, neurological physio, musculoskeletal. You got a lot of physio. And the last thing you want to do is make the mistake of, oh, I love muscles, I'm going to do physio. Honey, you will not enjoy. Physio is only 1/3 of the course. Then you've got the cardio respiratory, then you've got the neuro, and you have to know every single discipline. You have to be on placement for each discipline by the end of the course. You have to have gone through cardio patients, you know, dealing with asthma, emphysema, COPD, neuro patients. You got the stroke, you got the MS, multiple sclerosis, you got the neuromuscular patients, you got the degenerative diseases, you got arthritis, you got rheumatoid arthritis, sports injuries. There's a whole other world to physio that not enough people are doing research about, and you need to ask yourself, are you ready to take on all 3 disciplines, being able to suction a patient's sputum, helping them to clear their sputum from their lungs? Are you ready to facilitate a patient's movement, a stroke patient, because normally they are stuck in this position and you need to help them to regain that movement again? Are you ready for those days where you have little to no patience? Give the patient patience. Do you have patience? If you don't have patience, if you don't have patience, you ain't gonna have patience. If you don't have patience, you ain't gonna have patience. I said what I said. But I guess that's what makes physiotherapy much more fun. It's not just about learning the muscle and massaging people. You have one massage class and that's all you get. So as much as you might come in with the idea that, oh, I'm gonna learn how to give people massages and I'm gonna learn how to rehab them from sports injuries, darling, no, that's not, no. You have to be very healthcare minded and understand that the world is much more than just a bag of tight muscles. What makes a good physiotherapy student? A physio student has to be physically competent. It's manual labor. You got lots of manual handling to do. You need to be strong enough to be able to lift the patient off the bed, able to lift limb. Limbs are much heavier than people think when they're in a relaxed position. When you relax the limb and you're trying to lift the leg to assess their movement, to assess strength, to assess range of motion, you need to have some sort of physical competence to perform the task. Otherwise, you are going to fail. And if you are not strong enough, if you're tiny, if you're really petite, I'm not saying you won't make it as a physio, but you need to be mentally prepared. It's tasking. You will be tired. And if that's what it takes for you to become a physio, be prepared. Get ready and get set. get in the mindset that you will have to build muscle. Being proactive, if you can read ahead of the class and read around it and look for more information, always find opportunities to become a better physio, you are going to excel as a physio student. Talk about it, think about it, be a physio. Just because you don't have the certification doesn't mean you don't apply yourself into the world of the physiotherapy. Ideally, someone who is sports minded, partake in a sports activity. Most of my course mates, it would be running, athletics, gymnastics, volleyball, netball. For me, weightlifting, running. I play any sports. I play racket sports, badminton, squash, tennis, swimming, athletics, netball. Be someone who plays at least one sport. It's not compulsory, but it's always nice. It teaches you sportsmanship, working in a team. That's another thing. You need to be able to work in a team. If you don't want to work in a team, go do medicine. Physiotherapy is an allied health profession. You are working with everyone. You're working with podiatrists, nurse, the GPs. You're working with everybody to help this patient to regain their function. And if you don't want to work in a team in physiotherapy, this might not be the degree for you. Be prepared to do physical work. A lot of lectures will be practical lectures. I would say physio is 20 to 30% reading and 80% actually doing and practicing the skills. If you want to be the student who sits in the lectures for hours on end, day by day, comes back home, sits down, types essays all day, hours and hours in essays, physiotherapy might not be the one for you, because you always have to be active. Practice on people, practice on your friends, practice on your family. You can't preach muscle health and physical health if you're not doing so yourself. Confident, they're charismatic, they're always happy to meet new people. That confidence is what makes you a good physio, because if you are able to exude your confidence and portray your confidence in the work you are putting in, the patient is going to be confident in the results, in getting the exercise done. But if you're like, if you could just sit on this bed for me, could you just stand up for me, I don't know. If you're not sure of yourself, your patient is not going to be sure of you. Your examiner during the exam is not going to be sure of you. You lose marks for not being confident. Did you know that? I didn't know that. I failed my exam because I wasn't confident. I was like, I don't know, is that right? Is that right? It was terrible. It was, for lack of a better term, it was a shit show. That's what it was. Everyone felt sorry for me, but it's okay because I learned from that. It was only up from there. If you're a very shy person, fake it. Fake your confidence. That will get you through the doors. But if you really cannot open up, if you cannot release yourself, if you cannot be free, be confident in what you are doing, you won't go very far in this degree. Moving on, you have to be willing to keep learning and unlearning certain things. Be willing to bounce forwards and backwards, learn and unlearn, because research comes out, new research comes out, they might debunk a certain piece of research and you have to take an alternative route. Also have to be happy to help everyone. You can't just pick and choose who you want to be happy helping. You can't be subjective, you can't be biasing everyone, saying, oh, I only want to help rich people, oh, I only want to help this people, I don't want to help fat people, I don't want to help tall people because they're too big. You have to be happy to help everyone. That's what makes a good physio. Treat everyone equally, okay? Is physiotherapy hard? It's stressful, but it's only really ever hard if you combine the stress with a lack of passion. If you don't have passion for your course, if you're not ready to move forward, if you're not ready to do your own independent work, read ahead, read outside of your scope, if you're not ready to practice it and apply it to your daily life, you will struggle a lot more. You're not 100% dedicated to the task. You have to be working every day, you're standing up every day. A lot of people struggle with that. Coming up with that diagnosis is difficult when and if you haven't studied enough or you haven't acquired enough knowledge about pathologies. Like somebody presents you with XYZ, you don't know how to piece things together on the web to say, okay, this might be osteoarthritis, might be bursitis, this might be tendonitis. You don't have enough of that pathology word bank to come to a valid conclusion that this is what it is and this is the solution and I expect to see you this time and this is why you have this and this. You need to be able to justify every reason you give. That's why it's difficult, because there are multitudes of pathologies and treatments and assessments and you just have to be on your A game at all times. It definitely takes more than average personal training, but if you want to do more sports sports rehab. They have courses for sports rehabilitation, has sports therapy, sports exercise and nutrition. Other courses that don't require you to be stuck within the limits of cardio physiotherapy, neurophysiotherapy, musculoskeletal physiotherapy, dealing with older patients. You might want to be dealing with younger, more agile patients. It's up to you, but making sure you don't waste your time applying and thinking, oh, this is one thing, and you go there, you're writing your personal statement, you're saying to them, oh, I love sports and I know how to handle sports injuries, and I had a sports injury and I've done a sports and I've done a sports and I've done a fitness sports, physiotherapy. They're not looking for that. I can assure you now, those interviewers know exactly what will write you off, and I'm going to make a separate video on how to ace your physio interview, so stay tuned for that. If you like this video, go down there, smash the like button. I'm not done yet, but if you want more physio content, subscribe. Moving on. What can you get out of physiotherapy? Patients tend to give amazing life advice. You've got amazing patients. They are, not all the time, some of them are quite depressed, which is okay, it's completely normal. But majority of the time, you have patients who are more enthusiastic, more charismatic, more ready to tackle whatever they have to face. And it brightens up your day. The energy it's contagious. Keeps you excited for what the next day could bring. That's why I love physiotherapy so much. You never know what you're gonna get. Every single patient is different. They all have different personalities, different stories, different issues. They might have the same problem, but the story of how they got there completely different to each other person, to the next person and the last person. It's extremely rewarding, so you will get that feeling of accomplishment and knowing that you have helped this patient, you have rehabilitated them. You might get some gifts, you might get some free gifts, you might get thank yous and the cards. It's always a nice feeling. The pay isn't the best. But I can tell you now, if you can acquire the experience, I think the starting salary is 23k, 23, I'm not entirely sure, but the starting salary is quite low for an allied health. Like if you worked at Amazon, you'd probably be getting the same amount of money as a first year physiotherapist, band 5. Once you gather the experience and you move up the ladder and you improve your skill and your competence, you have limitless opportunities, limitless bounds. You could work for yourself, work privately, go to a different country, apply your skills there, a chiropractor, doctor, acupuncturist, in mental health, in the army, in the charities, in the schools, and endless possibilities, which is why so many people, especially master students, they come back having regretted not taking physiotherapy in the beginning to study, collect their degree so they can work, and automatically opens far more doors for them than if they studied sports therapy. It naturally increases your SQ and your EQ, your social intelligence, your emotional intelligence, how you create relationships, how you communicate with people. The more you practice it, the easier it is for you to be more confident, to relate with people, to be more empathetic, to understand how us humans work. People forget that physiotherapy is therapy. You are signing up to be a therapist. You will have to sit down with people, understand them, challenge their thoughts, challenge their beliefs, help them to alter their beliefs for them to better themselves. So whether you like it or not, you are going to become someone who is much more emotionally aware, socially aware of how us humans behave. That is priceless. And if you don't think studying physiotherapy is worth the money, I don't know what to tell you, because there are benefits people don't see outside of the frame. There's no money. Start thinking wisely about the courses you pick. People come to you for help and say, oh look, my knee's swollen, I don't know what to do with it, I don't want to go to the hospital because it's going to take ages to get treated. If they come to you, that's heartwarming. If you know you have the competence, you are certified, and you know that this is there in your brain and no one can take that away from you, yeah, blessing. Is it worth the 9.25k tuition fees and then you add the accommodation fee? Is it worth all the money? It is, and I'm not just saying this because I'm a physiotherapist. If you want to get into physiotherapy, please do it. It has different disciplines. I could listen to someone's breathing and know if they have an infection in their lung or if they're just a smoker. When I see someone walking down the street, I can see that they have a hip problem. Could it be arthritis? Something else with the muscles, something with the tissue. You have that automatic configuration in your head. You can put 2 and 2 together in instances. There is a gift. You could put a price on that, start your own business. Think about it. In conclusion, is a physiotherapy degree really meant for you? That's for you to decide. People who will make the best physios, the most caring people and the most active people make amazing physios. That is what makes a good physio. If that sounds like you, consider it. Do some more research on it. Have a look around, have a play, check if there's any other courses similar to physiotherapy. If they suit you, if they suit your personality, go for it. And if you like this video, go down there, subscribe for more videos like this, press the like button, and I will see you all in my next video. Bye. Don't forget, ask me any questions. Ask me questions. I will answer them. I love all of you, and I will see you later. Kisses, deuces, bye bye.